I represent MIT Critical Data. It's a global consortium that consists of computer scientists, healthcare professionals, and social scientists whose mission and vision is to put data and learning at the front and center of healthcare. We build communities across disciplines to leverage data that is routinely collected in the process of care to understand health and disease better and in the local context. This consortium is led by our laboratory, the Laboratory for Computational Physiology. And our flagship project is MIMIC. MIMIC stands for Medical Information Mart for Intensive Care. It is the first of its kind. It is a repository of ICU data that has been de-identified from patients who have been admitted to Beth Israel Deaconess Medical Center since 2002. And this is shared with the research community. We have close to 40,000 users that have produced 10,000 publications and conference proceedings trying to understand the effect of treatments, prediction modeling using data from the intensive care unit. And long believing that open access to data promotes knowledge discovery and also promotes quality checks of that knowledge, we make these data sets available. All one has to do is to undergo a human subject research training, sign a data use agreement, and you could access the data set. And we are about to release the 4th iteration, including data coming from the pandemic. And we encourage all our users to share their GitHubs and their notebooks so that other people can replicate their findings on this publicly available data set and can build upon each other's research. Last year, we published this paper, and in this paper, we demonstrated how trivial it is for computers to learn the self-reported race ethnicity based on the chest X-ray alone. Without any clinical data, the computers could know if this chest X-ray belongs to a white patient or a black individual. And the most perplexing thing is, we couldn't figure out how the computers are doing it. It wasn't the disease distribution. It wasn't because black people are more likely to have pneumonia and white people tend to have normal chest X-rays. It wasn't the soft tissue density. It wasn't the age of the patient that can be inferred from the bone structure. So until now, we still couldn't figure out why the X-rays are able to tell you if an X-ray belongs to a white person or a black person. And we replicated this across several medical imaging modalities. We replicated this in CAT scans and MRIs. And that's not the only story that is related to this. AI developers have also found that computers can figure out if the photo of the back of the eye, the retinal fundus, belongs to a woman or a man. And ophthalmologists have no clue because they themselves couldn't tell if the picture they're looking at belongs to a woman or a man. And more alarmingly, we are finishing up a study where we trained computers on normal chest X-rays, and we were able to train them to select which images belong to people who are on Medicare and Medicaid. Computers can tell if you're poor or rich. Why do we care that computers can identify race, ethnicity, sex, or socioeconomic status from data sets? What does that mean for us in the machine learning community? That brings me to the story of Clever Hans. Clever Hans was a horse who in the 1900s was bought by this retired schoolmaster named William von Osten. And during his retirement, he was bored. He started teaching Clever Hans to perform simple calculations, addition, subtraction, even square root calculation. And he took the horse on road shows. But it turns out that Clever Hans was not performing the calculations. He was sensing the heartbeat of William von Osten and the people around him. So every time William von Osten points to the correct answer, he gets excited, everyone gets excited, and the horse knows that that's the correct answer. When they blinded William von Osten to the question, so he doesn't know, he was just pointing randomly, it turns out that Hans was not clever at all. All the answers were wrong. Do we have examples of Clever Hans in machine learning? Absolutely. These two investigators built an algorithm that would differentiate a wolf from a husky on photographs. But it turns out all the wolves were photographed with snow, and none of the husky photos had snow in the background. And not surprisingly, the computers knew that if there is snow in the background, this is a wolf, rather than looking at the animals. This can happen too. If computers can tell if you're binary or non-binary, if you're black or white, if you're rich or poor, they will use those to make decisions. After all, we're training computers using human data. And bringing me to the story of MacArthur Wheeler. MacArthur Wheeler is a middle-aged gentleman who, in the 1990s, robbed 2 banks in Pittsburgh in broad daylight without any mask, without any disguise, and he even smiled at the surveillance camera on his way out. That evening, he was picked up by the cops, and he was so perplexed. He kept mumbling, "But I wore the juice, I wore the juice." It turns out that McArthur Wheeler researched lemon juice and found invisible ink and found that it's made of lemon juice. So he put lemon juice all around his body, thinking that he was invisible. So the cops tested him for alcohol, for drugs, and it turned out that McArthur Wheeler wasn't drunk or stoned. He was just incredibly mistaken. Is there a McArthur Wheeler in the house? As members of the machine learning community, a lot of us are oblivious to the fact that racial information, sex can be embedded in the data that we're using. We are oblivious to the fact that there's so much bias in the data that at this point, we are not ready yet for these algorithms to be in the front line. And just to end, consider this tool. It is a tool where you could upload a photo of a suspicious mole, and it will tell you the likelihood that it's carcinogenic, it's cancerous. But consider the fact that this algorithm was developed on primarily photos of white individuals. And worse, it is able to learn if the photo that is uploaded was taken by an iPhone or a cheap Android. And of course, it will know now that photos taken by iPhone is less likely to be associated with cancer. And stories like this can happen. We will have more and more misdiagnosis and medical errors as a result of scaling AI that are developed by the McArthur Wheelers in this house. Thank you.